the National Health Service. He's joining us from London. Thank you so much, Dr. Gupta, for sparing the time of day and being with us. I have to begin by asking you, this revelation in terms of the UK variant being more deadly, how worrying is this?
Well, thank you for having me on the show. It's quite worrying. We initially thought that it's 70% transmissible, which was what we got from all the studies that were being done. But now we're seeing that it's also more deadly. One of the things that we were reassured about when we heard about the increased transmissibility was that at least it's not more deadly. But now that trend has also been reversed, and about 30% more deadly, as you said, in certain age groups. It's important to understand, however, how this data was accumulated. So the increase in mortality is not in patients that are admitted to the hospital. This is a general increase in mortality of the population that is infected with coronavirus, new strain versus the old strain. So I think it's important to understand that the patients that are admitted in hospitals still have the same mortality as before, but it's the community transmission that has become more worrying. And not only is this variant faster spreading, which we saw in the numbers in the United Kingdom, but it's also more deadly. And we had 1,400 cases recently, which is the highest, 1,400 deaths, recently, which is the highest that we've ever had since the start of this pandemic.
Right. Dr. Gupta, the reason why this is not a UK problem. The UK strain, as we know it, has spread to more than 60 countries now. But the question really is, what is the age group that is most susceptible? Who should be worried? Because we know that this strain also spreads rapidly among younger people.
Yes, absolutely. You see, the issue with this strain was that when world travel is going on, when the globalization has happened, people are mixing quite a lot. It's a lot less now than before, but it's being transmitted to other nations quite fast. Within weeks, it was seen in Australia. And I think that that increase in transmissibility led to various countries having it. The United States has reported at least 12 to 17 states within the United States have now gotten the UK strain. But the age group that is most affected, according to the data, is the 60 and above. So the elderly and the more vulnerable population in terms of the mortality. Yes, it's faster spreading in the younger population, but it's not known to be more deadly in the younger population. It's still more deadly in that more vulnerable, older age group, especially those patients that have comorbidities like diabetes, heart disease, high blood pressure. And, as we do more research on this, we will figure out what exactly is causing the death in this particular variant. There's multiple variations of this virus that has been seen, but B.1.1.7, which is the new variant that they're talking about, is the one that has the most number of mutations that can cause an increase in mortality.
Right. And just to, understand how this B.1.1.7, as it's known, is different. One, of course, is that it's more contagious. Now it has been revealed that it's also more deadly. But the other interesting revelation that a lot of experts are in fact talking about is that this mutation essentially changes the way the virus enters the human cells. Can you tell our viewers a little more about that?
Yeah, so the virus has a protein on its outer coating known as the spike protein, and it's just like a spike that attaches on to something. So it attaches on to the ACE receptors in our lung cells, and then it gains entry into the lung cells. And the vaccines, the treatments that we have been trying so far, all target this spike protein. It's the antibodies that we make against the spike protein that prevents the virus from attaching onto the lung cells.
Right.
Now, the mutation that has happened within this spike protein, and there's not been one but multiple mutations that have happened that allow it to latch onto the lung cells a lot faster than it used to.
Okay.
And that's why we're seeing the increase in transmissibility. Yeah.
The million-dollar question, are the vaccines that are being used currently effective against the new strain? I think this is the most commonly asked question. And I know, Dr. Gupta, that you yourself have already taken the first shot of the vaccination.
Yes, I had my first shot of the Pfizer vaccine last week in the UK. It's a million-dollar question. Nobody has the answer to that at this point. All the research that is being done, and it's been actively done in the UK and in the US that shows that there is no evidence that proves that the variant or the vaccine is not effective against this variant. We still have enough evidence to show that the vaccine will be effective, but only time will tell. You know, once we vaccinate enough people and we check their antibodies down the line, we check for reinfection rates, and we check for mortality in about 6 to 8 months. That's when we'll really know whether the population that has been vaccinated is truly protected against all these different variants or not. 6 million people in the UK have already been vaccinated. They aim to vaccinate up to 15 million by the end of February. And it's a race against time. It's a race against vaccine versus variants.
Right. I have to, before we let you go, I have to ask you, you said that it's still anybody's guess whether the vaccines will be effective against the new variants. The question then is, how is the UK especially coping given the current situation, an unprecedented rise in cases and deaths? Is the healthcare system very overburdened at the moment?
Oh, absolutely. The NHS is a publicly funded healthcare system. It's the largest public healthcare system in the world of its kind, where free healthcare is provided to 70 million people, and it's no doubt about it that it's overwhelmed. Where I work alone, patients numbers have increased. Most of the wards are now COVID wards. ICU numbers have increased, and patient mortality has also gone up.
Right.
So I think definitely the system is overburdened. The doctors, nurses, and all healthcare staff are also undergoing mental and physical fatigue during this time.
A quick comment. India so far has reported 150 cases of the new variant. What's your advice to countries like India to contain the spread of the mutant strain?
It all comes down to effective contact tracing and isolating the strain in the labs, and then finding out, who has it and contact tracing them, and also making sure that they are isolated in an institutionalized facility. I think it all comes down to effective control of the virus by looking at who has it and then isolating them to prevent the further spread. And immigration, travel restrictions, all of these play a role in that.
All right, Dr. Gupta, thanks so much for sparing your time and being with us. One sincerely hopes that the vaccines are effective and countries like India are effective in containing the spread of the mutant strain. Thanks so much for speaking with us.
Thank you for having me. Thank you.
Well, on to the other